Hi, welcome to Lincoln Memorial University Radiographic Imaging. My name is Phoebe Bodwig, and today I'm going to talk about the hand. The outline for this lecture is as followed. First, we are going to identify normal hand anatomy. Second, we are going to be identifying fractures by using this systematic approach. And last, we are going to talk about developmental hand anatomy. Pictured to our right, we have an x-ray of a normal hand. We're going to identify all the bones on this hand. To me, the carpal bones are particularly hard bones to learn, so I like the mnemonic, so long the pinky, here comes the thumb. And now we are going to identify all of the carpals on the hand, starting with our scaphoid. We have our lunate, triquetrum, pisiform, hamate, capitate, trapezoid, trapezium with the thumb, flexor pollicis longus, sesamoid bone. We have our metacarpal bones, our proximal phalanges, our intermediate phalanges, and last we have our distal phalanges. Before we start looking at fractures, we need to develop a systematic approach to evaluating a fracture. I like to use the ABCs: A for alignment, B for bone, C for cartilage, and S for soft tissue. Okay, so here's our first fracture. We'll begin evaluating this fracture by outlining our metacarpal bones to see if there is any discontinuity. As we get to our fifth metacarpal, we can see that there is a fracture. I'll find it on the left hand, and also I want to note that you can see our flexor pollicis longus sesamoid bone again. So the last x-ray we saw was a boxer's fracture. When a person comes into the emergency room and they have a boxer's fracture, you will be able to tell because they will present with symptoms of no knuckle. This is commonly fractured by punching with a closed fist, hence the name boxer's fracture. And the fracture occurs transversely across the metacarpals, typically the fifth metacarpal like we saw. Okay, so here we have another fracture. We will begin analyzing this fracture by tracing the cortical outline of each of the carpal bones. So far we are not seeing any fractures. We'll go down to look at our ulna. And as we get to our radius, we can see that there is in fact a fracture. I will find this on the right hand side of the screen. And this is called a Colles fracture, which we'll talk a little bit more about in just a second. A Colles fracture is commonly seen in high impact traumas and in elderly patients with osteoporosis. The common mechanism of a Colles fracture is falling on an outstretched hand. Okay, so this is the last fracture we're going to look at in this sequence. We are going to begin by tracing the cortical outline of our metacarpal bones. So far we are not seeing any fractures occurring. Now we'll move on to identifying our carpal bones. beginning with our triquetrum, our hamate, capitate, lunate, and as we get to our scaphoid, we can see that there is in fact a fracture. I will denote it with a star and find it on the left side of the picture as well. Okay, so like I said, this is a scaphoid fracture. The scaphoid bone is the most commonly fractured carpal bone. Here is another picture of a scaphoid fracture, just showing you a little more clearly where the fracture is occurring. The primary mechanism for a scaphoid fracture is falling on an outstretched hand with a deviated radius. Now we are going to talk about developmental hand anatomy. This is a valuable tool for age estimation. From the 1950s to now, epiphyseal plates have been closing on average 3.5 to 4 years earlier. This is important to use when evaluating the more modern generation's hands. Here we have the hand of a 10-month-old. Note the ossification centers and that there are no carpal bones present or epiphyseal plates. Now we will be looking at the hand of a 24-month-old. Note the ossification centers and the presence of an epiphyseal plate on the radius, our proximal phalanges, the metacarpal bones, and also our intermediate phalanges. Now we have a picture of a 3.5-year-old. Note that we don't have ossification centers anymore, just carpal bones, and our epiphyseal plates are getting a little bit bigger. So now I'll find them on our metacarpals. And note that they're all distal until you get to our thumb, and it's a proximal epiphyseal plate. And now I'll find just a few more epiphyseal plates on this hand. Now we are going to look at the hands of a 10-year-old female and a 10-year-old male. Starting with the female, we can see the scaphoid, the lunate, the triquetrum, hamate, capitate, trapezoid, and trapezium. I'll find these all in the male. I want you to pay particularly close attention to how far spaced the male's carpals are compared to the females. This is just showing that females mature quicker in their bone growth. And it's also important to know this for when you look at a fracture, because you could be looking at an epiphyseal plate and you want to know the developmental process of each female and male. And now I will circle some of the epiphyseal plates on the male hand as well as the female hand. For our last picture, we're going to look at the hands of a 13-year-old female on our left and a male on our right. I will circle the carpal bones just to show a little more about how close together they are on the female and how far spaced they are still on the male. So on the male we have our triquetrum, our hamate, capitate, our trapezoid, trapezium with the thumb, scaphoid, and lunate. And now I will just circle a few more of the epiphyseal plates on these two pictures. Thank you for your time, and I hope you enjoyed this video.